afternoon or good evening to some. Welcome to our discussion on the spiritual impact of the COVID-19 pandemic in spirit and in truth. My name is Sylvia Gray. I'm the president of the Memphis Area Tougaloo Alumni Chapter. Along with the Washington Area Chapter, we would like to welcome you to our second session of a series of discussions on the impact of COVID-19. I'd like to thank all of our participants on the phone or joining us today. Importantly, I would like to thank our moderator, panelists, and the Washington chapter for collaborating with us and planning such an important forum. It is our plan to continue the discussions as the information is changing constantly. This discussion will focus on current medical updates and the spiritual impact of COVID-19 pandemic. With our moderator and our panelists, I'll go ahead and introduce them, and then we'll have a few housekeeping items afterwards. We have Dr. Doris Browne, who is the 118th president of the National Medical Association and the president and CEO of Browne and Associates, LLC. Dr. LaTonya Washington is the physician advisor at St. Francis Hospital here in Memphis and currently serves as the president of the Bluff City Medical Society. Dr. Marshala Lee is a board-certified family medicine physician and serves as the director of Harrington Value Institute Community Partnership Fund at Christiana Care in Delaware. Mrs. Maxine Bolden serves as Tougaloo College chaplain and as pastor of Union United Church of Christ at Tougaloo College. Dr. Larry Johnson served as the Tougaloo College chaplain for 47 years until his retirement in 2019. And Reverend Cassius Rudolph is currently serving as interim pastor of the Saints Memorial Community Church of Willingboro, New Jersey, and the executive director of the People's Consortium for Human and Civil Rights, Incorporated. Just a little housekeeping, all participants' lines are muted. Please submit your questions and comments via the chat feature, and questions will be answered at the end of the presentation. As always, please feel free to submit ongoing questions via the chat function. We will continuously monitor your submissions and will respond throughout the presentation. All questions that are unanswered at the end of the session, or if you have other inquiries, we will forward responses through email to all participants. Now, we will look at our disclosures and disclaimers. There are no disclosures unless explicitly stated by each panelist. The information presented represents the views of the individual panelist and may not be representative of their employers or event sponsors. The content presented in this presentation is intended to provide general information regarding the novel coronavirus 2019 and not intended as a medical consultation, diagnosis, or treatment. If you feel that you require medical attention, please contact your physician or go to the nearest emergency department. Now I will turn everything over to our moderator, Dr. LaTonya Washington.
Good afternoon, everyone. Thank you all for joining us. So I have the privilege of joining Dr. Lee to give you a brief medical update of the COVID-19 novel coronavirus. So we will go ahead and get started, and then we will lend to our spiritual leaders after that. So when we talk about the demographics of the COVID-19 pandemic, it's important that we talk about where we are currently. So as of May 2nd, which was yesterday at 10:45 p.m., in the United States, there were about 1.1 million cases of coronavirus, and then also 66,369 deaths. So when we think about that, we had our last session on April 11th, which was just about 3 weeks ago. So when we were there, at that time, there were only 519,000 cases in the US. And the number, I didn't document the number of deaths at that time, but you can see we've almost doubled the number of cases of coronavirus in approximately a 3-week time period. So then we'll go on to look at some state-specific data. We here are the Memphis chapter. We also want to talk about Mississippi, since that's where our beloved Tougaloo College is located. And so when we look at the Mississippi cases, the total number of cases in Mississippi, this is as of May 1st, was 7,441 cases. Going back to 3 weeks ago, the number that we reported was 2,642 cases. So that's almost 3 times as many cases at that time. And the total death rate was 291 deaths in the state of Mississippi as of May 1st, and 3 weeks ago, that number was 93. So the death rate has tripled. And to delve in that a bit more, you have been hearing a lot on the news about how these numbers are disproportionately affecting African Americans. You can see by the number of cases and the number of deaths in the state of Mississippi that African Americans are more affected by this disease than our Caucasian counterparts. You'll also see on a couple of the slides, they have listed as other or under investigation, and that simply means that they are unsure of the race of those persons. And then so moving on to the state of Tennessee, I believe is the next slide that we have here. So the number of cases in the state of Tennessee as of May 2nd was 12,661 cases with 209 deaths. When we go back to look at 3 weeks ago what those numbers were, when we had our last discussion, the numbers that I reported for Tennessee was 4,891, and the number of deaths reported was 98. So the number of cases is almost tripled, and the number of deaths has doubled since that time. And again, you see also that the number of African American cases as well as deaths is out of proportion to the percentage of the population that is African American within the state of Tennessee. Also note that you have the pending. Again, that means that they are unsure of the race of those persons in the death data that has been reported. I think our next slide is the District of Columbia. So I'm gonna let Dr. Lee talk about that since she lives in that area. I will say before we start though, the last time that we had this session, the number of cases in Washington, D.C. was 1,178, and the number of deaths in D.C. was 47.
Sadly, as Dr. Washington mentioned, African Americans and Latinos continue to contract COVID-19 at a disproportionately higher rate than our counterparts. This is the same, sadly, for many communities across the United States, including Washington, D.C. As of May 1st, there were a total of 4,797 cases and 240 deaths. African Americans comprised more than half of the cases, and even more startling, made up 80% of the COVID-19 related deaths. We must continue to remain vigilant and protect our families and our communities. Here are a few tips for keeping safe. Most likely you have heard of these tips, but please continue to put them into practice. Wash your hands often with soap and warm water for 20 seconds, or hand sanitizer that contains at least 60% alcohol. Clean commonly used surfaces often. Try not to touch your face. Stay 6 to 10 feet, if not more, away from other people. Most importantly, Stay in your home unless you must leave to work or complete essential tasks. If you have to leave your home, please wear a mask that contains a proper filter. Lastly, if you feel ill, please call your medical provider as soon as possible prior to going in. Symptoms. We continue to learn more and more each day about the presenting symptoms of COVID-19, which often appears to vary person to person. Common symptoms include a dry cough, shortness of breath or difficulty breathing, fever, chills, muscle pain, headache, sore throat, diarrhea, new loss of taste or smell, and most troublesome, many people have no symptoms at all. These people are called asymptomatic carriers. This slide contains a few symptoms that are emergency warning signs, which should prompt everyone to seek a emergency medical treatment as soon as possible. These include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to arouse, worsening weakness, extreme headache, difficulty speaking, blurry vision. It seems like COVID-19 is increasing the stroke risk for many individuals. Bluish lips or face. This list is not all inclusive. Please consult your medical provider for any other symptoms that are severe or concerning to you. Call 911 if you have a medical emergency. Notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives.
So next we'll talk about telehealth or telemedicine. This is one thing that has really been growing since we've entered the COVID-19 pandemic. Before, there weren't many providers for telemedicine or telehealth. Really, it's a way that we can enhance the medical care that people are receiving. There have been a lot of changes with government regulations regarding providing telehealth services, which I think has been very good to help out access to care during this pandemic. So when we talk about telehealth, what does that mean? It means a phone visit or a video visit. Now they're doing visits over platforms like Zoom or FaceTime, things like that. They also have mobile monitoring that's available. A lot of times for patients who have COVID-19, one of the things that we talk about is that the oxygen level may go down. They have these really neat apps that are available on your phone where you can check your oxygen saturation level to determine if it's low or high, to let you know that you would need to seek additional care. So there are a number of things that are available. In advanced settings, they do have the ability to do remote patient monitoring. Those things can be set up if a patient has to go to the hospital and maybe being discharged, so that medical personnel can kind of remote in and see what your heart rate is and what's happening to you while you are at home. So these technological advances are really amazing at this time, because remember, as doctors, we are ones who still carry pagers sometimes. So that's kind of an archaic thing. So they are really bringing us into this new millennium and new time. And I think that it's a positive thing for both the physicians that are involved, but most certainly important for the patients. So the thing that is that this helps is that it increases your access to care. If you think about patients who may not have a car, may not have transportation to be able to get to the hospital or get to a doctor's office, you can have a telehealth visit with your doctor to address your chronic medical conditions, to address any new conditions that you may have developed. That way, distance isn't a barrier. There's some certain communities that have that don't have providers of certain specialties, so telehealth really helps with that. Particularly, we've seen that for mental health providers, and we've seen that for certain highly specialized people, where patients may have to travel, hundreds of miles to be able to get to those providers that they need. So that has been one of the things that's been really important for us. And then it really just provides a way for support for self-management. You know, we are encouraging now that patients would have would take some ownership in their care, and really be champions of their own care. And in this way, they are really the captain of that ship. So limitations to telehealth: some people simply don't have access to a mobile device or a computer or a laptop to be able to have this telehealth feature. Most people do have access to a telephone, so that will help with that. But then you also have certain patient populations that are unable to use telehealth features, like if they are unable to speak or something like that, then telehealth may not be the right modality for those persons. I think our next slide talks about testing. You know, this has been one of the things that's been very widely talked about in the media. Testing, we know that testing is not widely available. The initial viral test tells you whether you have a current infection. Again, the test is not widely available. We as healthcare providers are really saying that patients should have more availability to testing, but then also note that the test is only about 70% sensitive. And basically what that means is that if I have 10 patients in front of me that have coronavirus, only 7 of those patients will actually have a positive test. So 3 of those patients will have a negative test, even though they actually have coronavirus. And so you can see where that would be concerning, because those 3 persons may decide that they don't want to keep the distancing measures in place, or they may be interacting with other persons. The other thing that we've heard a lot about recently is talking about antibody testing. At this point, it's not widely available. There is a pretty low sensitivity. So just as I was talking about the viral test, the sensitivity of the antibody testing is also a bit low. And then there are numerous companies that are developing these antibody tests, and we really don't know how good one test is compared to the other. And then also, when you have antibodies, we don't know how long you would be considered to be immune to contracting the coronavirus again, if at all. So as far as treatment, one of the things to talk about right now, we don't have a cure, we don't have a vaccine. We are seeing in the news that there are several clinical trials that are underway on many drugs. Remdesivir is the one that is most prominent in the media these days. It's an antiviral medication that they are saying can be used in hospitalized patients to provide them with a shortened course, or to help them recover quickly. One of the limitations about the remdesivir is that it's only available in the IV form. So you can only get remdesivir if you're in the hospital. So it's not an option for treatment for patients who are not in the hospital. The other thing is the plasma antibody trials, and that's where they take convalescent plasma, meaning blood plasma from someone who has had the coronavirus infection and has recovered, and they administer that to a patient who's actively sick with the coronavirus to help them to recover in a more quickly. And then also the vaccine will really take several months to develop. I feel like on the news, we're seeing every day where someone says, oh, I think we can have the vaccine ready in a few months. Oh, I think we can have a vaccine ready next week. And that's simply not true. Vaccine development takes a really long time. And really, I think that 12 to 18 months is really the average amount of time that it takes a vaccine from production to being able to deliver. So that's where we are with treatment. I also wanted to take some time out to talk about the advocacy piece. One of the things that I've been seeing in the hospital is the communication is a lot different. You know, I feel like patients get the best care and the patients recover in a more timely fashion if their family members are with them. We're really seeing at this point that since family members are unable to come to the hospital, it really heightens anxiety for a lot of people. So these are just some tips to keep in mind in case you have any loved one or family member that may go to the hospital during this time, whether it's for the coronavirus or for any other thing, because most hospitals and clinics are restricting the visitation for people at this time, for people who are not receiving care. So it's important that you designate one family member to be the point person to talk to the doctors, and that person should be able to relay information to the other members of the family. Also, it's important to know your loved one's medical history, know their wishes, and know their end of life plans. One of the things that I read and that we are encouraging for our patients and family members is to write that information down. And if your loved one has to go to the hospital, you should have a list of who their primary care doctor is, what medications and doses that they're on, your name and contact phone number. If you have any type of power of attorney or anything over that person, then to include all of that information with them when they go to the hospital. The next thing is phone calls and video chats are really the best way to stay in touch. So if anyone has to go to the hospital, it's important that you make sure they have a cell phone, make sure they have their charger with them. If they don't have those things, a lot of hospitals are really instituting like virtual visitation using iPads, using Zoom, FaceTime, things like that as a way to stay in touch, to talk with your loved one who is in the hospital, but then also to talk to the doctors and nurses who may be providing care. The other thing that I wanted to say is if you are having issues with one of your family members in the hospital, if you feel like you can't get in touch with people, then make sure you know the phone number to the hospital to be able to contact patient relations or the ethics team. Also, you can call to talk to the charge nurse that's on that unit where your loved one is, or the nurse manager, anyone that you can talk to within that healthcare system to really make sure that you can get your concerns addressed. And this goes really for everyone. I will say that I had an experience where someone I knew was in the hospital, and I called to try to get information about them, and I had to call the hospital 4 times as a physician. And I acknowledged myself, I identified myself as Dr. Washington when I contacted them, and it still took multiple times. It's also very important that we stay informed of the latest treatments and medical updates, and then be persistent.
I'll now be talking about the importance of holistic health. Many of us are truly understanding the importance of holistic health, which includes physical well-being, emotional well-being, and spiritual renewal. Individuals with chronic diseases such as high blood pressure and diabetes appear to have the worst COVID-19 outcomes. There are many factors that we can't change. This is why it's so very important that we do our best to eat healthy, exercise, and live healthy lifestyles as best as possible. This has been a very stressful situation for us all. Stress can worsen chronic diseases and weaken our immune systems. We also know the healing power of physical touch and supporting each other. That's why, instead of advocating for social distancing, we are encouraging physical distance while staying socially connected. We truly need each other to survive and must continue to be creative in the ways that we provide support to our family and friends from afar.
So we will also talk about here talk about reopening. We know a lot of states have really been talking about reopening. Many states reopened this weekend. So I think that across the board here, our medical professionals on this panel agree that it's much too soon for that. Many cities are really seeing increases in the number of cases. We are seeing an increased number of deaths as well. with this reopening, I think that what we'll see is an increased number of both cases and deaths. Probably we won't see the effects of it for about 4 to 6 weeks. And then if you watch the news at all, then you are able to see that they have a multitude of stories about packed beaches, packed parks, all of those types of things that have happened within the past 24 to 48 hours. So we would really say proceed with caution when you are considering going out. Really for me, and the advice that I've given to my family and friends is to continue to do the distancing measures and only leave your home when absolutely necessary. And since this is the spiritual impact, you know, one of the things that we would certainly want to talk about is church services. We all understand the importance of gathering in an assembly for worship, but we also understand that being in close quarters like that also will encourage spread of the disease. So the WHO has actually given us some guidance. This was produced back on April 7th, 2020. And some of the things I agree with and some of them I don't. But I will make sure to tell you those things. So really, it's very difficult to distance being in religious gatherings. You know, we see people that we know and that we love. We want to hug on them and kiss them and do all of those things. We want to shake their hands and all of that. So it's very difficult to not do those things when it's someone you haven't seen in a while. If you think about several religious gatherings in certain churches, they have a holy item that they touch or kiss, you know, that would support spreading of the disease. So we shouldn't do that. Also in certain denominations, when taking communion, today is First Sunday, so many of us would have taken communion in our home churches. Sometimes they drink from the same cup, and a lot of touching is involved. So you would certainly see that would lend itself to disease spread as well. So really, right now, a lot of churches have really branched out with the technology, having Facebook Live, YouTube streaming, all of these types of things. And in my opinion, I feel like it has brought us closer together and closer to the Lord, even though we are not physically together. So, and then another thing that I will touch on just briefly is that we've also had to really adjust the way that we do our burial practices. Many people aren't able to have a distinct funeral service because of this infection, because we know that the virus is still able to be transmitted even after the person has passed away. So we really have to be concerned about that as well. So that's the end of my proceed with caution statement. We have a list of references here. We are happy to make our slides available after this presentation to anyone who would like this information. I think that next up, we will have Dr. Doris Browne, and she will be able to give us a health policy update. So Dr. Browne, I'll hand it over to you.
Well, good afternoon or good evening to everyone. There are several pieces that I would like to speak on in reference to the COVID-19 pandemic and the impact that it has on the population. As you've heard, the largest percentage of deaths happen to occur in the African American population. And the latest numbers have certainly indicated that 30% of the deaths are related to African Americans, while we only represent 13% of the population. And many people have asked the question as to why is this? And I think much of the information that you've already heard really speaks to that. But I think we have to really look at the social determinants of health and how they are magnified during this pandemic. And again, when I talk about social determinants of health, we're talking about where we live, work, play, and pray. And all of those things impact the health that we have and the chronic diseases that we have as an outcome. And of course, then that really adds to whether we have insurance or we are underinsured, whether we have access to health care. And once we then call those 911 numbers that you've seen on the screen or you get there, are you going to be allowed to get in to get that care? We know that testing is important, and I've heard of numerous cases of individuals being turned around because one, they did not have a cough, or two, they did not have an elevated temperature. Those kinds of things have added to why we have to advocate for a change in policy to expand upon the care that we're going to receive. And so as we look at the as we consider post-COVID-19, how are we really going to work to make sure that we improve the care that we're going to receive? And again, here you're looking at talking with your legislators and your policymakers to make sure that we have expanded condition to improve upon our housing. Make sure that our educational system is improved. I think with the COVID-19, we're seeing that our educational system really has lots of holes. Many individuals, as you've heard, trying to provide care in a virtual capacity did not work because many students do not have the capacity to be taught at home. If they have a computer, it may be one in the home for several students. And then there's always issues about the internet provider service, whether you can get access because it has not have the broad bandwidth to provide that. Other things that we know, and again, the PPEs, the provider protection equipment, and whether enough of them to go around. We've heard of individuals having to get a shipment of masks, of N95 masks to come in from overseas because they've run out given this crisis impact. So those are all things that we need to look at. And if this is an issue for the major hospitals, we know that small hospitals, rural hospitals, and the federally qualified health centers are going to be at the bottom of the totem pole for getting these kinds of services. Also, with African American patients, we really like to go to and we receive better care if there's a concordance of the provider and the patient. And of course, the trusted providers are those that are generally in the same racial or ethnic group. And we know that some providers have, we say unconscious bias, but I think it's really conscious bias, and they may turn a patient away. And that is why when several people have made it back to the emergency room, it may be their third visit before they were allowed to come in. Those are all factors that impact the outcome of the African American population, coupled with the chronic underlying disease, whether it is heart disease, diabetes, another immune compromising illness. When we look at what are we going to focus on post COVID-19, and you've heard about telehealth. Telehealth is a wonderful modality. Many providers do not have that in their offices, and they're quickly setting it up. We know that from a political standpoint, the reimbursement for all of those providers are not the same or equal or equitable, across the board. And we have to work to make sure there's equitable reimbursement for the telehealth services. And because we know that many patients are not going in to see the doctor because of we now have social distancing, we're going to see a tsunami of patients trying to seek care when the COVID-19 pandemic has subsided, or at least the stay-at-home has been removed. And when that happens, we want to make sure that they have the available services. In addition to, and speaking about telehealth, there were rules about crossing state line of having adequate services to provide that for providers. And all of those things are being worked on. Importantly for us, because you're now beginning to hear about certain specific treatments, the remdesivir, whether you should take hydroxychloroquine and other medications. Know that if you're going to seek and get those medicines, whether it's in a compassionate care position or not, you should be part of a clinical trial because none of those drugs have been approved by the Federal Food and Drug Administration for use in COVID-19. And we know that often as a provider, we tend to sometimes use a drug that was approved for another condition, and it is okay to switch that. Again, it must be told you that if you're going to get that. And so we would recommend making sure that you're getting it as part of a clinical trial. Remdesivir has had both positive and negative outcomes. And again, we're looking at the data. You want to make sure that it is in a scientifically valid study with a number of patients to be representative of your population and will have applicability for you. We also really don't have a full understanding of the true extent of this disease because we have a number of individuals that are asymptomatic, but yet they are considered to be carriers of the disease, but they are not there because we are only counting those individuals that have gotten to a treatment facility and have tested positive in that sense, or tested positive and have sent back home to remain in quarantine for X number of days. So we need to do data collection. Very important for us to start to look at data collection, and that means we have to do contact tracing. This is a real public health problem, and we have not looked at our public health infrastructure to know if we can do this. We haven't had contact tracing for a disease for many, many years. But I think with this disease, we have to be aware of that coming back into place. And I would be remiss if I didn't mention the environmental component of this disease. It is really important as to why African American patients might die at a higher rate than others. And as I said, you really have to look at those social determinants. And one of those determinants happen to be the environment that we live in, that we are exposed to in our workplace, whether we come in with asthma or other respiratory illness that may have an impact on the air that we're breathing, or the contaminated water that we might be exposed to. So I think we have to look at our exposures, our underlying disease, the stress of this illness, the stress of not having insurance or not having a job, and the impact of all of that on our health. And so I think if we look at improving our outcome and working on policies that's going to get us to the next level so that we can overcome this disease, working together, having trusted providers that you go to for your care, and then to make sure that your policymakers are looking at you as they put out new legislation that's going to impact the care that you receive, and whether that is providing telehealth that's going to cross state lines, that's going to be covered with all insurance, and again, whether you're going to be reimbursed at an equitable rate. We'll be happy to answer questions, and thank you.
Yes, thank you, Dr. Browne. So next we're going to get into our spiritual implications. We're going to have our esteemed presenters, Chaplain Johnson, Chaplain Bolden, and Reverend Cassius Rudolph. I think that we were planning to have Chaplain Bolden to start us off. And so we will go ahead and get started, followed by Chaplain Johnson, and then ending with Reverend Rudolph. So Chaplain Bolden, I will unmute you, and then you can go ahead and get started.
Good afternoon, everyone. Thank you all so much for the opportunity to be a part of this. In preparing for today, we are looking at what might we do spiritually to be encouraged. And so I've shared just a brief meditation with you. Today is Good Shepherd Sunday, and our meditation comes from Psalm 23, which most of us know talks to us about the Lord being our shepherd. And I will share it even though most of us know it, and I will be brief with you. The Lord is my shepherd, I shall not want. He makes me lie down in green pastures. He leads me beside still waters. He restores my soul. He leads me in right paths for his name's sake. Even though I walk through the darkest valley, I fear no evil, for you are with me. Your rod and your staff comfort me. You prepare a table before me in the presence of my enemies. You anoint my head with oil, my cup overflows. Surely goodness and mercy shall follow me all the days of my life, and I shall dwell in the house of the Lord my whole life long. When we think about all that we're going through, many of us, especially as African Americans and people of color, rely on our faith to get through hard times like this, through times of trial, times of challenge, times when we know that we are absolutely not in control, not that we're in control at any other time. But when we think about the Lord being our shepherd, a shepherd doesn't just send us somewhere. A shepherd comes alongside, leads us by making sure the path is straight. The shepherd comes behind us to protect us from anything that might follow us into the spaces that we're being led. And when we think about God being our shepherd, we know that God makes every provision, even in this time of COVID-19, in spite of running out of tissue paper, in spite of running out of water and hand sanitizer at the grocery stores. Many of us have more in some places than we had before this situation evolved. Because God has been providing. God has been making us lie down in green pastures. Even though green pastures don't look the same to everyone, it's been an experience of knowing that God makes sure that we have a place of rest, that God leads us beside the still waters, that there's no storm in our life that we can't trust God to settle and to help us to be at peace. And the word says he restores our soul. In this season of COVID-19, more people are being still and spending time building family connections, spending time slowing down, spending time. That is such an important currency for us, time. And so as God restores our soul, we're encouraged to be still and to rest in the Lord. As God helps us to follow the right paths, to follow instructions, to be obedient to our medical and our government officials, one of the things God does for us is to help us to do the things that are best for God's name's sake. For his sake, let us be obedient and prove our faith as believers. And as a pastor, and all of you know, as Dr. Washington mentioned, this is a season where people have been dying not only of COVID-19, but of other things. And communities are being fractured. People are not able to go through the valley of the shadow of death in the way that we culturally go through. Funerals tend to be a place of pastoral care for us. And it tends to be a way of working through our grief and mourning in public, weeping with those who weep, rejoicing with those who rejoice. But we have not had that opportunity. But the word says that even though we go through those dark valleys, we don't fear evil. We don't fear what is happening. While there will be an appointed time maybe where we can have some public lamenting, some public memorializing of those who have gone on, we know that God is with us as we're going through. And as a community, what we can do is to continue to be community even more, reaching out, calling, being kind, checking in, being grateful, and operating in the spirit of joy and support for those who are experiencing loss, not only physical loss, but job loss, who are losing benefits, who are losing in other ways. We can continue to minister to each other so that we can go through the valleys, the dark places, knowing that God's rod, his word, and his staff, his strong hand, comfort us. And as God continues to provide for us, I would encourage us, and God encourages all of us to remember that even while this pandemic is present, we are being fed, we are being provided for, to the point that our cups run over. We have more information that we need. We have support in ways that we get. We also are connecting with each other as we share what we do have. And we also are being made aware of the things that are not happening, so that we're being empowered and we're being informed to engage the powers that be, so that after this, there will be glory, so that we can confront, so that we can change, so that we can lobby for those who are the lost, the least, and the last. And finally, let us be mindful that while we're going through, whether we're going through it with all that we need or if we're going through it in lack, the mercy of God continues to be faithful, continues to be with us, continues to be available to us, so that goodness and mercy follow us every day as we go through. Let's be encouraged that we are not alone in this. This is God's world, and we are God's people. And we are people who believe in giving and sharing and being community. Let's live into that in the ways that we can, so that we might be the hands and feet of the shepherd. Amen.
Thank you, Chaplain Bolden. Chaplain Johnson.
Yes, good afternoon all. And let me give kudos to the Memphis Area Chapter and the Washington Area Chapters for reaching out to the community as you are doing. This means that those individuals who may feel that they are alone can understand that they are not alone. So your reaching out is more than an activity. It for some, it could be a lifeline. So kudos. I'm to give a short talk on how to cope with social isolation. The operative word here is cope. There are various ways of coping. There are healthy ways of coping and there are unhealthy ways of coping. And I think the category that one would fall in would depend on how he or she understand themselves in the context of other people, whether they are overly dependent on the company of others, or they feel at home wherever they are. What this pandemic has done is challenged people across the globe to redefine themselves in terms of their self-image, that sense of themselves, that sense of being in community. And all of that is important because having a positive understanding of who you are in the context of others or in the context of a community, not necessarily localized, but as you're demonstrating here, a community that has a wide net. You are reaching a lot of people who normally would not have access to this kinds of conversation and information and what have you. What we're in now is a period when individuals have a heightened sense of anxiety and fear, and those things lead to various stages of depression. So here again, coping, the way one copes has everything to do with how one is able to manage themselves emotionally, mentally, psychologically, under the circumstances of being, under the situation of being isolated, home alone, one might say. But here again, social isolation does not have to be a burden. It offers us an opportunity to be creative, knowing something about yourself that you've not discovered, a time to discover new talents that you may have, an opportunity to find different ways of reaching out to neighbors or communities. There are all kinds of things that can enable a person to not be isolated per se emotionally, but find healthy ways of coping and being a contributor. And one of the things that I want to mention here is that the order of nature, the order of the universe tells us that we are susceptible to that order. We must be in step with that order. And for that thinking that says God is going to protect us from this plague, this coronavirus, I don't think he has said, get behind me, I'm going to protect you from this. He simply said that we will be with you wherever you are. But we must also understand that you don't tempt God. You don't put yourself in a position to say, God, save me or deliver me, when we have foolishly allowed ourselves to get into that kind of a situation. So be very, very careful with the idea that you are immune to this, that God's going to protect you, that can be an unhealthy way of trying to cope with the circumstances. And ultimately, that leads to harm for an individual's family and friends and so forth. So coping and a sense of well-being are key to dealing with anxiety or reducing the level of anxiety and stress and dealing with that depression as well. So coping, how you choose to cope, has everything to do with how creative you are in dealing with circumstances that we're all having to deal with. And with that, I'm going to say that's all I have for you on this particular subject. Thank you for allowing me to be a part of this conversation, and be blessed.
Thank you,
Amen.
Chaplain Johnson. Reverend Rudolph, we will hand over to you. Also, I will just give an echo and say, make sure that you enter any questions that you have into the Q&A section. For those of us who are, those of you who are following us live on Facebook, we are also manning that feed as well. If you have questions, please don't hesitate to enter them, and we will address them at the end of the session. Reverend Rudolph.
Thank you so much, Dr. Washington, and to our chapter presidents from WATAC and the Memphis Area Alumni Chapter. Thank you all for including us. This has been a very informative session with a lot of information that we can take back with our churches via our different mediums, whether it be Zoom or Facebook Live. And it's just so good to see all of you, especially good to see you, chat. Good to see you. But with the matter at hand, listen, we're living in a different world. So we're talking about fear, anxiety, and death is what I've been tasked to talk with. And we know fear is one of the enemy's most popular weapons that he uses against us. Worry, anxiety, fear can overwhelm us with this sort of thing, this thick shadow of darkness, controlling our every move, our decision. The world as we know it is rapidly changing right before our very eyes. I mean, our worst fears try to get the best of us. So just for a moment, I have a closing meditation for us. Tales from the Valley, Living with Fear and Faith, how to navigate through the valley of fear, anxiety, and death. And there's a scripture that comes to mind in the book of Isaiah, Isaiah 43, 1-4. And it says this in NIV version. But now, God's message, the God who made you in the first place, Jacob, the one who got you started, Israel, says this: don't be afraid. I've redeemed you. I've called you by name. You're mine. When you're in over your head, I'll be there with you. When you're in the rough waters, you will not drown or go down. When you're between a rock and a hard place, it won't be a dead end. Why? Because I am God, your personal God, the Holy of Israel, your Savior. I paid a huge price for you. That's how much you mean to me. That's how much I love you, says the Lord. I will sell the whole world to get you back, even trade the creation just for you. So let's talk about this thing. Tales from the Valley, living with faith and fear and navigating through our valleys of fear, anxiety, and death. And as you know, faith in the life of a believer, and even those who may not believe and question, it is very important on this spiritual journey, on this thing we call life. Faith plays a major role in our daily lives. If you think about it, it is the faith that one has which sustain a person. It was right here in this text that we see in Isaiah who said it best, but it was also recorded in Romans 10:17. So then faith comes by hearing, and hearing by the word of God. One cannot have faith without hearing and reading the word of God. Without it, how can one believe in the workings of Jesus Christ and whom we believe in? How can one believe in the death and the burial and resurrection if one does not have any faith? How can one even navigate through life experiencing fear, anxiety, and death without having faith? It is your faith that keeps you when trouble comes. I'm a witness of that, and I know all of us are believers. We know that faith comes when times of trouble. Jesus tells us that you will have troubles in this world. It's guaranteed. You will have trials and tribulations in this world. It's guaranteed. You're going to have situations that come and try to knock you off your square, knock you down. It's guaranteed. However, the word of God, Jesus promised that we have victory through our faith because Jesus Christ has overcome the world as well. So listen to this, family. If you are facing hard and uncertain times, which we all are, you can be encouraged in knowing that you are an overcomer. You are an overcomer. You can be encouraged and press your way through anything, no matter the storm, no matter the situation. You can make it. You can make it. So, but the question we have in front of us is this: what happens when fear settles in? What happens when fear gets the best of you? Do you let it control your actions, your beliefs? And if I was at church, I'd say you'll let it control your praise. Will you let fear control your very being? No, this is what you do. You reset. You keep on believing, you keep on trusting, and you keep on hoping that everything will be all right. Everything will be all right. 2 Timothy 1:7 says us this: for God has not given us the spirit of fear, but of power and of love and of a what? A sound mind. Sometimes we forget that last part, a sound mind. Chap just told us, let us not be confused and try to test and tempt God that we're so exempt from diseases and things like that. God has given us a sound mind as well. So when you get fearful, be ready and let fear know I am strong and I am courageous. Do not be afraid or terrified because of them, for the Lord your God goes with you. He will not leave you nor forsake you. And that's recorded in Deuteronomy 31:6. So fear and the testing of your faith can also help you in this moment, in times like these. Listen to this. It's when you're at your wit's end, when you're down and out, nowhere else to go, when God really shows up in your life and lets you know that God is right there. He's right there, even when you thought you were walking alone, and the Lord shows up and says, I will get you through this period of stress and anxiety, even in the face of death. We have seen fear, anxiety, and the threat of death in the word of God. And I'm wrapping up, but listen to this. Even the disciples, those of us that go to church, we know that even the disciples, the Lord's crew, the brothers that he handpicked, they even got scared. They got scared. Excuse me, I forgot I'm talking to my Tougaloo alum. They got scared. They got scared because they knew that folks was going to come after them because Jesus was just crucified. They were his followers. And they were scared, trying to figure out what's going to happen to them because they were followers of Christ. So, but isn't that how we might feel? I mean, are we feeling like this now? We are living in a time when it doesn't feel right. You can't go out and enjoy weather like you used to. I mean, you got to go outside wearing a mask. You can't go to your favorite restaurant. You know, I love Cheesecake Factory. I'm not a chef. I don't like to cook. I can't go to my favorite restaurant. I mean, life for us is not normal. The fear of the unknown comes and prick our mind. I know some of us was looking at these information that our doctors was giving us like, oh my God, I mean, we can have no symptoms. And so I say this, and I say it now. Take this time to lament, cry, let it out, question things, and be honest with yourself. Admit that you are fearful. Admit that you have stress and that you're afraid of death. Admit those things. It helps. But I want to encourage us all. Fear will try to get the best of you. Fear will try its best to stress you out. But you must remember that you are more than a conqueror through Jesus Christ. Faith is the way. And you ought to say this to yourself. My faith, it outweighs my fear. And that's why I want us to take courage in what we read in the beginning in that Isaiah 43 in the first few verses. Here the Lord says this, and I'll be done. The Lord has rescued his people. He reminds the descendants of Jacob who they are, who they belong to, and who created them. He tells them this, and we can take this to the bank. I, the Lord, created you and form your nation, Israel. So listen to this. Don't be afraid. I have rescued you. I called you by name, and now you belong to me. So if you want to know how to navigate through fear and anxiety, think on these last closing things. God is with you. God will rescue you. God knows your name, and you belong to God. Thank you so much for this opportunity.
Well, thank you, Reverend Rudolph, for that inspiring message. I think we have a few housekeeping things that we have to discuss before we end. Just to let you all know, there have been some questions that we have answered within our chat feature, and I will just go over those for a few moments. We have myself and Dr. Lee, we've been answering these questions in our chat feature, but I will just go over them a bit so that we can make sure that we address everything. So we have a question in the chat that says, African Americans in LaFleur County, I'm assuming that's Mississippi, lead in COVID-related deaths. What do you attribute this unfortunate truth? Do you attribute this unfortunate truth as race, or what do you attribute it to? So I answered this question. I said we attribute it to a number of things. There are studies that show that pre-existing conditions such as obesity, hypertension, and diabetes show an increased risk of death for those affected by COVID-19. We know that in our southern states, such as Mississippi, we certainly see a disproportionate number of persons that are affected by those conditions. That's one of the reasons that we're seeing. Also, the Mississippi Delta overall has a lack of access to adequate health care, which may also contribute to that. And then we have to also attribute the generalized distrust of the medical community, meaning that those persons may not seek care in a timely fashion, and also they may get to the hospital when they're at a critical state, and it may simply be too late for to provide care to those persons to be able to overcome their illness. The next question we had is, what should we expect next fall if small colleges such as Tougaloo can't fully reopen? It will be disastrous. I and Dr. Lee answered that question. We said we're hopeful that measures can be put in place so that businesses and colleges can fully reopen. Things may look very different at all levels of education, with the need for smaller class sizes and utilizing more technology to educate our youth. Dr. Lee answered, unfortunately, the medical and public health communities are preparing for the likely possibility that COVID-19 will still be with us in the fall or will return in the fall. That's why it's important now that we all start planning for this possibility and strengthen our ability to provide effective virtual learning. We have another comment from one of our Tougaloo alum who is a dentist, and he wanted us to comment on dental care and whether it should be limited at this time. And really our opinion is that dental care with someone having to do things in the mouth, there's no way to limit droplets, respiratory droplets during that time. So dental care really should be limited to only emergency care at this point. An additional comment, I think it's pretty long, so I'll read it. There's evidence that a company from Japan has a 40-year research product that has helped the body heal itself from all viruses and sickness with no side effect. Would it be possible? Let's see, this is a pretty long thing, but it's talking about a company from Japan having a product that will heal itself from all viruses and sickness. We are hopeful that we will have the ability to have a safe and effective treatment. Now, anything that anyone is stating will heal all viruses and sickness, I am automatically skeptical of. But if we have not seen it yet, then only the Lord can heal all viruses and all sicknesses. So I'll just leave it at that. And that's my own personal answer there. If anyone has any additional questions, someone asked on the Facebook live feed if this video will be saved. Yes, it will be available on Facebook for now, and then we also are recording the video that we will be able to distribute widely. Let's see. And then we have one other question that is in the Q&A asking about when we purchase masks, should we be washing them before using them? So the current recommendations are to use face coverings when you leave your home. If those are cloth masks, you know, you certainly can wash those before you use them, and you should wash them regularly. Really, the recommendations are to wash them on a daily basis, because if you imagine if you're wearing a mask, you're having your respiratory droplets on the inside of the mask, but everything that is in your community is on the outside of the mask. And we know that some viral particles can still go through those cloth masks. It's not as protective as the medical grade mask. So it is very important that you wash those on a regular basis. Thank you for that question. And then I don't see any additional questions that we have, so I will, Sylvia, do you have any additional comments?
No, just briefly, just to say that it has been a pleasure being with everyone today. Thank you so much for your interest and attention. And it's my hope that today's discussion has been insightful and relevant. Kathy Mosley is on the call, the president of the Washington chapter. I'll just yield to her for a few remarks, and then we'll turn it back over to you, LaTonya, just to close us out. Okay. Thank you again.
Thanks, Sylvia. My just abundant thanks to our esteemed panelists, our Tougaloo family professionals, for their willingness to share not only their knowledge and experience, but their insights. We appreciate them helping us to continue to be grounded and connected while yet practicing responsibly spatial distancing. I particularly am pleased that in many instances they allowed us to be validated, you know, that they validated our emotions and our feelings. Sometimes we just need to know that that this is not just you, and that it is real, and that, you know, that we're thinking soundly. So I appreciate that very much. Also, my thanks to those who joined us on Zoom for helping us to make this event possible, and to because they want to, everybody wants to be informed, more empowered and encouraged, and I think that that's what today's discussion certainly accomplished that. As I said before, the last event and this one, I certainly am pleased on behalf of the Washington Area Tougaloo Alumni Chapter that the Memphis chapter embarked upon this socially conscious and necessary exchange, allowing us to be in touch with our family members throughout, and for helping us to be a part of this. And we really appreciate that, both in the planning and discussion of it. So thanks to all.
Thank you, Kathy. So we will like to be conscious of everyone's time. We're a bit over our 1 hour mark, and so we thank everyone for joining us. I do have a couple of things to talk about before we close out. The first thing is that, you know, number one, our slides are available. This video will be available. For those of you all who were registered on the Zoom conference, you will receive a survey and a link. On that link, you will have the link to Giving Tuesday. Tougaloo College has embarked upon Giving Tuesday, which will be on this Tuesday, May 5th. As a fundraising effort for the college, they have instituted a new fund that will be considered an emergency fund for students who are at Tougaloo College at the current time. So that link will be included in that email that you all will receive tomorrow. So please give to Tougaloo College for all of those who are involved, who have attended this session today. The next thing is that we also want to talk about additional fundraising efforts that we have for the college. The Memphis Area Chapter is hosting a talent show, and it's called The Lou's Got Talent, and we are going to do that virtually. There's information available on the Tougaloo College Facebook page, and you will get more information from the college directly about persons who have talents that they would like to broadcast and be a part of that. We will have judges that will judge and determine a winner, but then we will also have people's choice, meaning that people can tune in for the program and vote for the contestants that they would like to win. And there is a cash prize involved with that, but the goal of this is fundraising for Tougaloo College. So the majority of our proceeds we will donate directly to the college for the students. The last thing that I would like to say is that we all know that this weekend would have been commencement weekend, and we are sad that we are not at our beloved Eagle Queen celebrating with the 2020 graduates. I would personally like to thank all of those graduates and congratulate them on an amazing accomplishment. We all love Tougaloo. That is why we're here. That is why for many of us, 10, 20, 50 years later, we are still supporting the school that we love. This
And
weekend
more.
would have also been the 90s reunion. And in doing that, we would have had an opportunity to celebrate the 90s reunion. From my understanding, they have an after party, which I guess they are saying the Zoom call spiritual talk after party that's going to be happening immediately after this event. I believe it started at 6 p.m. Central, 7 p.m. Eastern. So for those of you who are on this call, if you can hop over to the next one, the information is in the Facebook group. I will also look forward to see if we can add that to the link so that everyone can come and celebrate along with us. So this has been a very serious session, but then we will go and kind of let our hair down and connect with a lot of our fellow Tougalooans on a social level where we can de-stress. So thank you all for joining us. I appreciate it. Please look forward to our next session. We will give medical updates because that is always pertinent. But it looks like our next session will be talking about the economic impact of COVID-19. So look forward to that in the coming weeks. So I thank you all for joining us, and you all have a wonderful evening. Please stay safe and stay healthy.